So I think chronic hand eczema is a spectrum, which is one of the reasons why I think it's so complicated when it comes to even making the right diagnosis. So I think first and foremost is considering what could be in the differential diagnosis of CHE. And this includes things like psoriasis, which I think is the hardest one to distinguish, and we'll talk about that in a moment. But you have to think about secondary syphilis, pagetoid reticulosis, lichen planus, and there are many others. However, when it comes to the kind of mishmash that could be simply hand eczema of atopic dermatitis, irritant contact dermatitis, and or allergic contact dermatitis, it could be independent, two of the three or all three, it comes down to history. In this fashion, asking the right questions, getting to the meat of what is the recurrence rate, what are associations temporally in terms of whether it be occupation or things someone does at home. By definition, chronic hand eczema should last for more than 3 months with recurrences. It's really going to be based on the history first and foremost.
So trichoscopy has changed the landscape for diagnosing certain alopecias and hair loss disorders versus seeing under the microscope because it's quicker to do. It doesn't take as much time as doing a biopsy. You can do it just as long as you have a dermatoscope, pretty much on any patient that's complaining about hair loss. It's less invasive than a biopsy as well. It doesn't give as much information as a biopsy, but if you're limited in time and you really just want to get some baseline answers and preliminary diagnostic information to your patient, trichoscopy is very effective and very helpful.
So many clinicians are experiencing burnout and they don't know what to do. So they know that maybe I need to slow down, maybe I need to ask for more, assistance, but they don't really know the framework that will get them from burned out to feeling like, yeah, this is sustainable. So I created a framework and I walk people through that during the talk. So I use the metaphor of my husband's a forester. So when you have a controlled burn, you burn down a forest and you're getting rid of invasive species, you're getting rid of some of the scraggly trees that may block out the light, and you're making room for new growth. The soil is also going to be richer as a result of this burn. And so I know it's hard for people to realize this when they're going through burnout, but burnout can be the thing that catapults you to a better place in your career. It gives you the opportunity to look at what's working, what's not working, what do I want to move toward.
To the gold standard of using narrowband UVB, and we're going to have new medications hitting the market. So that's a misconception that there's no treatments. Yes, we have treatments. The other misconception is, okay, I've had my vitiligo for 20 years, I'm probably not going to repigment. No, that is not the case. No matter how short or how long you've had your vitiligo, I always instill hope into my patients that there is that potential that we can repigment your skin.
Alopecia areata is increasingly becoming more understood as an immune-mediated disease. And when we think about the components of the immune system that are mediating this hair loss type condition, it's actually the T cell compartment. So it's a disease wherein the T cells are attacking the hair follicles in what's typically an immune privileged space. So we actually have T cells migrating into an area of the hair follicle and causing inflammation that results in hair loss. What we see clinically is usually coin or circular shaped areas of non-scarring alopecia that can transform and extend to be complete hair loss in the entire body in things like alopecia universalis. Because of that, it makes a lot of sense to target the T cells to treat this disease. And when we think about some of the best T cell targeting medications that we have available to us, those are JAK inhibitors. JAK inhibitors specifically inhibit the signaling pathways that are critical to T cells to not just flourish and develop, but also mediate some of their pathologic effects.